Type 1 diabetes is not as common as type 2 diabetes, and its onset is usually at a younger age. This disease can cause serious problems for your body, if not detected and controlled in time. What is type 1 diabetes? Type 1 diabetes. Diabetes is a chronic disease that occurs when the blood sugar, glucose, level in the body is too high. Type 1 diabetes, also known as juvenile diabetes or insulin-dependent diabetes, occurs when the pancreas produces little or no insulin. Insulin is a hormone that stimulates glucose, which is the fuel source for your body's cells, to enter cells. This process is different from type 2 diabetes, which is a condition in which the body does not use insulin correctly or does not have enough insulin to balance blood sugar levels. Type 1 diabetes is quite rare. Out of every 100 patients with diabetes, only 5 have type 1 diabetes. Click and view a diagram of glucose metabolism and absorption in type 1 diabetes. Why do you have type 1 diabetes? Type 1 diabetes treatment. Before determining the cause of type 1 diabetes, you need to be aware of how your body's glucose metabolism works. Glucose metabolism. Saliva and chemicals in your stomach convert the food you eat into glucose, a form of sugar, which is the main source of energy for your body's cells. The liver also stores some sugar, but in the form of glycogen. If you don't eat enough or when blood glucose levels are too low, glycogen will be converted into glucose for the body to use. Blood vessels absorb sugar and transport it to cells, but cells cannot use this energy source without the help of insulin, a hormone produced by the pancreas. The pancreas receives a signal that glucose is present in your blood and produces more insulin. By allowing glucose to be absorbed into the cells, insulin lowers blood sugar and thus, the pancreas produces insulin. Destruction of pancreatic cells. Type 1 diabetes occurs because very little insulin is secreted from your pancreas. Pancreatic cells, specifically pancreatic beta-specific immune cells, lower insulin levels so much that it's no longer enough to control your blood sugar levels. Genetics can also play a role in this process, and exposure to certain environmental factors, such as viruses, can cause disease. On the other hand, the usual causes of type 2 diabetes are different. In type 2 diabetes, the cells of the pancreas are still functioning, but your body is resistant to insulin, or the pancreas does not produce enough insulin, or both. Can you get other diseases with type 1 diabetes? People with diabetes during the COVID-19 season. The possible complication of untreated chronic diabetes in both type 1 and type 2 diabetes is necrosis, which can make the person disabled. Without proper treatment and control, the body's cells cannot absorb glucose from the blood and will gradually die. Necrosis usually occurs in the lower part of the body. In addition to gangrene, you may have a serious disorder called diabetic ketoacidosis. For diabetic ketoacidosis, the body accumulates substances, ketones. Ketones in the blood make the blood acidic, affect many organs including the brain, and can be life-threatening, if not detected and treated quickly. Other fatal complications of diabetes are heart disease. Diabetes greatly increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, angina, heart attack, stroke, narrowing of the arteries, fibrosis, atherosclerosis, and high blood pressure. Neuropathy. Too much sugar can cause damage to the walls of the small blood vessels, capillaries, that feed your nerves, especially in your legs. This condition can cause tingling, numbness, burning, or pain, usually at the tips of your toes or fingers and spreading up your body. Poorly controlled blood sugar can cause you to completely lose feeling in your extremities. Damage to the nerves that affect the digestive tract can cause problems such as nausea, vomiting, diarrhea, or constipation. For men, it can lead to erectile dysfunction. Kidney disease. The kidneys contain millions of small blood vessels to filter waste out of the blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, requiring dialysis or a kidney transplant. Eye damage. Diabetes can cause damage to the blood vessels of the retina, diabetic retinopathy, potentially leading to blindness. Diabetes also increases the risk of other serious vision effects, such as cataracts and glaucoma. Damage to the feet. Nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. If left untreated, cuts and blisters can become severely infected, often difficult to heal, and may eventually require amputation of a toe, foot, or leg. Skin and mouth disease. Diabetes can make you more susceptible to skin problems, including bacterial and fungal infections. Complications in pregnancy. High blood sugar can be dangerous for both mother and baby. You have a higher risk of miscarriage, stillbirth, and birth defects when your diabetes is not well controlled. For the mother, diabetes increases the risk of diabetic ketoacidosis, diabetic retinopathy, gestational hypertension, and preeclampsia.